Oh, hello, Marlene. Thank you for helping us. I'm Dr. Raza, one of the examiner, and
I'm Dr. Wood, the other examiner.
Hi. What we'll do is first we'll just calibrate the scenario, and then we'll talk to you for a few minutes. Is that all right?
Okay.
Oh, okay. You read the scenario, haven't you?
Yes, yes.
Okay. To me, it is simple breaking bad news.
I think that's right. That's going to be the main communication skill we're interested in.
So we need to just go through calibration first and agree on what we expect people to get out. And reading through the scenario, I thought the first under communication skill is the process of start, the introduction, possibly a warning shot. Okay?
Yeah.
So you're happy with that, shall we?
I think so. So we can combine all the breaking bad news issues into one, can't we? Yeah. So the communication skills issues are establishing what the patient knows.
Exactly.
Using the warning shot, being clear.
Absolutely.
And truthful. And then I think something about negotiating a plan at the end, wouldn't it? So
yes.
That they've come to a joint agreement about what's going to happen next.
Yeah. In terms of numbering them, the next one I thought was that they should be able to give a very clear and firm diagnosis, because the investigations are pretty clear, aren't they? So they should be not waver from the diagnosis. So they need to confirm the diagnosis. Yeah. The third point was that they should be able to give a very clear, realistic diagnosis and prognosis, not try to picture too rosy a picture or equally not too bleak a picture, because there's so much uncertainty.
And that, I think that's quite interesting with this one, isn't it? Because in MS it's uncertain, so how they handle that issue about prognosis will be interesting.
Yes. And in the end, as you said before, they should agree an action plan, what they're going to do.
Yeah.
And, okay. The second part of the calibration sheet is about patients' concerns. And I think the main concern for a 30-year-old educated professional would be to accept the diagnosis. It's life-changing.
Yeah. Yeah, so that's going to be number one there, isn't it?
Yeah.
Okay.
And then how it's going to affect their future life. She's a young person, she's recently married, she's a successful accountant, so she would have questions about life
issues and
So
and about perhaps pregnancy and future, those sort of things.
Yeah. And then the other concern, I'm sure, should be about available treatment, whether it's available on the NHS, or expensive treatment might come in.
Yes.
So, but just available treatment would be
treatment.
In terms of clinical judgment, I thought the most important thing is that they should exhibit their basic knowledge of multiple sclerosis, how it's diagnosed, how it's confirmed, and what the prognosis is.
Yes, because we don't want them to go through too much history, but actually to show that they understand the significance of the tests they've had would be
Yes, and also the prognosis and waxing and waning kind of thing. I think that will be about the clinical judgment, and finally maintaining patient welfare. In this kind of scenario, there's a potential risk that they could cause hurt for psychological and emotional reasons, and that would be completely unsatisfactory.
And I just want to go back to number E about the ethical principles.
Exactly.
So we should ask them to demonstrate those now, and perhaps in the discussion we can ask about ethical principles and how they've applied them to managing this particular scenario.
Yeah, it would be mainly honesty and autonomy. Right. So if you look at the marking sheet then, and so we're going to assess people under these headings. So clinical communication skill assessment, as we agreed, 4 main things, and I would expect that to be satisfactory, they would show at least 3 skills.
Yes, I agree with you.
Yeah. But I think all these concerns probably should come up for discussion, and it will depend how do they handle that.
Yes.
Okay.
And I think for satisfactory, we would expect them to go through all of those issues, wouldn't we?
Yeah, exactly. And clinical judgment, as we said, that they will exhibit their knowledge of multiple sclerosis, how it's diagnosed and its prognosis, and also the knowledge of ethical principles and how it applies in this particular scenario.
Yeah.
And we talked about patient welfare. If they cause any distress, socially, so psychologically or emotionally, then it's completely unsatisfactory.
Okay.
Yeah.
Yes. Happy with that.
Thank you, Marlene. As we were agreeing what we expect the candidates to get out of this scenario. So you've read the scenario, and can you tell us if there's anything that you want us to clarify for you?
I suppose with the glasses that I'm wearing as the character, would that kind of throw it in a bit? Because she had an eye problem about a year ago. So will they be focusing, because I'm wearing glasses, on my eye problem?
No, I don't think that's not related, is it?
No, I don't think it is. And presumably those are your normal glasses. So yeah, I think that's fine. They shouldn't bring that up.
Also, the MRI brain scan. I mean, it says on here that it goes through a long tunnel. I mean, she'd know what it was, so she could call it what it is, couldn't she?
You're an educated person. Yeah. You would know. So it's for probably those people who may not understand it. But yes, you don't need to go into that. Anything else that...
The questions, I mean, would I be saying them all, or just...
Not necessarily. I would have thought that you should just play by the ear and see how the discussion goes. But if it starts drying up, then it'll be these there for you to just get the discussion going.
Okay.
And I think one of the things that might be quite useful would be to start off perhaps almost in denial, because that's quite a reasonable reaction to it, and anxious about, you've been in hospital, you feel that you didn't really, you went home without really knowing what was going on, and you've now come back and you've waited, and so there's quite a high level of anxiety beforehand. So I think moving from perhaps being in denial to accepting it, to thinking about the future as we go through the interview, that would be helpful.
And when they give you the diagnosis of multiple sclerosis, then initial unacceptance or denial, saying no, it can't be true, something like that will see how candidate negotiate with you, and that will help us. Okay.
Thank you.
Thank you. So we're ready for the candidate now.
Shall I go and
you're going
bring
to read
Dr.
on the
Chu through?
question.